Christina, there you go. Good morning, everyone. My name is John Newstreet. I'm the president and CEO of the Kissimmee Osceola County Chamber of Commerce. As you can see on your screen, I'm joined by the CEOs of 4 of our local hospitals, great partners in the community and great partners to the Chamber. I want to welcome you to this, I believe, 5th or 6th webcast. Again, I'm John Newstreet with the Chamber. This is a Facebook Live, so as we go through the show today, this may be a little longer, closer to an hour. But as we go through it, I'll encourage you to put any questions or thoughts, concerns you may have into our Facebook Live thread. We'll be monitoring that throughout the discussion this morning. And as a reminder, of course, you know, the Chamber mission statement is champions for business and community. And not only are we joined by these champions in healthcare and in the community today, but they represent and themselves are true heroes as they guide us through this COVID-19 crisis and back to health. So the underlying theme we really want to stress today, as you hear from them, is the fact that you have great healthcare providers, safe places to go if you're sick, to not ride it out at home, to work with our partners here in the community, to get checked out, to go to an urgent care, to go to the emergency room, whatever's appropriate. But now's the time to get healed, and these folks are more than capable of doing that. So with that, I'm going to turn it over here with a brief introduction to another partner of ours, Ken Peach. Ken is the Executive Director of the Health Council of East Central Florida. He also serves with numerous local health planning boards, including the Osceola County's Community Vision Health Leadership Council. He's got quite a repertoire, including a bachelor's and MBA degree, and I just want to get right to the thrust of it, so I'm going to hand it right over to Ken to make introductions and some further background on our healthcare landscape. Ken?
Very good, John. Thank you so much, and good morning, everyone. Johnny asked me to go ahead and give you an overview to start, and I pulled the statistics as of Monday from the Department of Health in Osceola County. Probably you're aware that they're doing a very good job putting information out on a daily basis. So far in Osceola County, as of Monday, there were 516 COVID-19 cases. 506 of those were residents of Florida. 10 of them were non-residents. The total tests done, 6,637 tests, 6,075 were negative. We had 516 positive, 8 deaths, and there were 130 resident hospitalizations. So certainly Osceola County has been impacted by COVID-19, no question about that, as all counties have been in Florida. And so the topic today, or the look, is what are we doing from a reopening standpoint? The hospitals are beginning to be able to do elective surgery cases again. So we thought this is a perfect time to take a look and look at where we are as we begin to get slowly past the COVID surge. And where are we as far as the hospitals and opportunities are in Osceola County. So we wanted to start out this morning with Shella Rankin, who is the CEO of AdventHealth in Kissimmee. AdventHealth also has Celebration Hospital. She started working at AdventHealth in 2006 and has held different leadership roles within that organization. Previously served the board of Osceola Council on Aging and is currently a trustee of the Kissimmee Osceola County Chamber of Commerce and a board member of Park Place Behavioral Health Care, the behavioral health provider for Osceola County as well. Sheila, in the next 4 or 5 minutes, can you just update us on what's going on as far as AdventHealth is concerned in Osceola County?
Sure. Good morning, everyone. Thank you for the opportunity to be here with you. I am proud to lead and serve in this community, and I am even more proud to serve alongside our amazing nurses who we celebrate and honor for a week beginning today. So happy Nurses Week. It has been a difficult several weeks, but thanks to the great support from our community, including wearing masks, social distancing, and staying home where possible, we have been able to reduce the impact to our community that was once predicted with the COVID-19 pandemic. So thank you. I'd also like to take a moment to thank all the people and first responders who showed up at our facilities to thank our frontline staff. Thank you for the encouragement and energy boost. I know it meant the world to our staff. Thank you to those who gave and continue to give donations generously to support our healthcare heroes, whether it was with treats, homemade items, flowers, protective equipment, numerous food donations by area restaurants and retailers. It definitely warms my heart to watch our community coming together during this crisis. So thank you. For the past 6 to 8 weeks at AdventHealth, we have been focused on keeping our teams and our patients safe. We have made many drastic changes to the way we deliver care to keep everyone safe. Keeping everyone safe means also knowing who has the virus and being able to get them treatment they need. That's why, to aid the community, AdventHealth set up drive-through screening and testing sites like the ones in Osceola Heritage Park, Mall of Millenia, and the one in Davenport, among others in Central Florida. We have tested thousands of people, and those numbers just keep growing. As of this past Monday, we have pivoted to open our network to provide the needed care for the community, including elective procedures. We're opening our doors to the full spectrum of care that we're accustomed to providing. How are we doing that? We have the resources needed and the personal protective equipment required to provide a safe environment for everyone. We will test you if you need to be tested, and we will keep you safe while you're here when you're admitted to our facility or come for an outpatient procedure. In terms of testing, all AdventHealth team members and physicians are being tested for COVID-19. That minimizes your risk of exposure in coming in contact with someone that's contagious or a silent carrier. Every admitted patient, as well as patients undergoing a procedure, will be tested for COVID-19, and only COVID negative patients will undergo elective procedures at our hospitals. We are taking precautions and want to help you take precautions. Therefore, all team members and visitors must wear a surgical loop mask when in an AdventHealth facility, and their temperature checked when they enter our buildings. Each patient is now allowed 1 visitor per day. That minimizes exposure. Robust cleaning and sterilization processes have been enhanced, and more sanitation stations are throughout our facilities. We have modified our treatment spaces. There are space and signage changes that you'll notice. We have placed stickers on the floor, keeping people 6 feet apart, as you can see here. This is what they look like. And we have placed laminated signs on chairs for people to keep proper distancing protocols. COVID-19 patients continue to be aggregated in cohort units to keep separate from everyone else entering the hospitals. Video visits are available to help those families stay connected. We are here to get you started on your health journey when you are. And what we're noticing is that some people are actually delaying some of the procedures and the care they're needed. And we want you to know that we are here for you. We will keep you safe when you need to come to one of our facilities. Thank you very much for the opportunity to be able to share this morning. Thank you, Ken.
Sheila, thank you. And you actually gave us a good look at not only what it is that you're doing, but some really good ideas to share with other entities and organizations and businesses as well. So we'll circle back on that a little bit later this morning.
Excellent.
I'm pleased now to introduce Thibaut van Marcice, Senior Vice President with Orlando Health. He's also president of the Dr. P. Phillips Hospital. Prior to his current role, he was Vice President and Chief Operating Officer for HCA North Florida Regional Medical Center in Gainesville, Chief Operating Officer of Medical Center of Trinity in Newport Richey, and Associate Administrator at HCA Health One in Colorado. He serves on the board of the Central Florida Hotel and Lodging Association, and he holds degrees from the University of Richmond and Virginia Commonwealth University. So, Thibaut, we're pleased that you were able to join us this morning.
Thanks, Ken, and good morning, and good morning, everyone. Really my pleasure to be here with you all this morning, doing a little bit of a healthcare panel in a new format, I think that we're all getting accustomed to. With all that said, we're making it work, and it's great to have the opportunity to interact in maybe a little bit more of a normal way rather than what we've seen over the last 7 or 8 weeks. I think let me share this. First, I want to echo some of the comments you've already heard. The past 8 weeks or so have been unprecedented for all of us, and certainly I think for For us who serve in healthcare, we echo that sentiment. You know, when I think back to that mid-March timeframe, the world was changing so rapidly around us, and we all had to adjust pretty rapidly to how to deliver care to a really unique patient population and a virus and disease that we were really learning about on the fly. I'm really proud of the work done at Orlando Health Facilities, and to be candid, at really all of our healthcare facilities across all systems in Central Florida and Osceola County and in the 4-county area. Because I think from my perspective, we were collectively able to really stabilize things in pretty rapid fashion, and something that I haven't seen before in my career. And so the theme that I'd like to share with y'all this morning really echoes what our theme was operationally, which was, how can we get our team members and our physicians and our patients to feel safe as quickly as possible? And we've learned a lot from those experiences. You know, we learned the value of social distancing. We learned how to properly take on and take off personal protective equipment, which is something that you know intuitively healthcare professionals have practiced with, but when you don't have to do it as often, it's maybe something that requires improvement. You know, our hand hygiene has been better than it's ever been before, and so I'm really proud to say that throughout the duration of this event, over the last 6 weeks, we have not had any transmissions of COVID within the 4 walls of the hospital with known COVID patients. And I think it's really important to share because, as Sheila mentioned, we are seeing trends that people are staying away from the hospital. And in some cases that may be appropriate because perhaps the care that they seek is not urgent or emergent. But in many cases, we're finding that these delays in care are leading to more complex issues. And so my reassurance to the community is that we have taken great strides, like AdventHealth has, like Osceola Regional has, and like St. Cloud Medical Center have, to make sure that our guests, our visitors, our patients, as well as our physicians and employees are safe each and every day. And so I'd like to run through some of those safety measures are. Likewise, we're masking everybody coming into the facility, employees as well as patients and visitors. We've implemented an advanced screening protocol that includes a temperature check as well as an 11-question screening that's based off of the most current CDC recommendations for COVID screening. So all patients and visitors are being physically screened at the doorways, and we've trained all of our team members and physicians on how to conduct that self-screen each and every day. And so that's occurring as well. Testing, as everybody has likely heard in the community, has been a big deal. It was very challenging 8 weeks ago, but has improved greatly. We at Orlando Health realized early on that we couldn't rely on outside testing, and so we developed our own testing capabilities. And as of today's date, we have the ability to provide all this, to meet all this, the testing needs that we have for all of our patients who are being screened for any kind of procedure, whether it be an elective surgery or a cardiac catheterization or any other procedure. So all patients are being tested prior to procedural so that we can take the necessary precautions. I'm pleased to say that by and large, we're seeing very, very, very low rates of patients that are coming in positive. For those that are asymptomatic, at Dr. Phillips Hospital, we've only had 1 positive screen for an asymptomatic patient, but all patients are being tested and screened in the procedural areas. And then likewise, we've taken precautions throughout our facilities to promote hand hygiene, ensure we have masking, have social distancing cues, likewise with floor reminders and signage reminders on the walls. And so really encourage the community that if you seek care, if you need care, that it is safe to come to our facilities to come get that care, and please don't delay. I will also share that There is an alternative. If going to the ER as a primary resource is not preferred, we do have a virtual visit platform, Orlando Health Virtual Visits, where you can talk to a primary care physician, and we have a dedicated virtual visit platform for COVID-19 where you can get immediate feedback and get an understanding as, do I need to get tested? Do I need to go to the hospital or not? So I do encourage the community that if you seek care, there are many ways that you can seek it in addition to coming to the hospital. The other thing I wanted to share with the community today, and this is an announcement that we made late last week, Orlando Health has taken on an initiative to work with the local business community to facilitate and to be a resource for businesses to reopen. We've launched a website. It can be found at orlandohealth.com/businessready, and really think of this as a virtual toolkit for the business community that contains downloadable content, which can be used for training or education, which includes some key topics such as what is COVID-19, and then other things that you're going to hear as repetitive themes today that are really critical. So how do you effectively wash your hands? How to take on a mask on and off properly? How do you effectively clean and sanitize surfaces? How do you self-screen for illness? And how do you effectively incorporate social distancing? The website contains videos as well as downloadable PDFs and PowerPoint presentations that can be used for staff training and public-facing signage that can be posted. It is available in both English and Spanish. And in addition to that, we have an email address where inquiries can come in if there are additional questions that aren't answered on the website, or if additional guidance or support is needed. And that email address is businessready@orlandohealth.com. And so we are having some conversations with businesses. Some are just answering questions, and others have inquired, can you help support us with testing or with screening, or can you sit on a task force that we've created to provide clinical expertise? And so we believe that it is our responsibility to take what we've learned and to leverage our medical and clinical knowledge and expertise to help and support the community and local businesses to get back up and running. As we all know that learning how to live in this new norm is going to be critical for the success and future of our community. So with that said, really can appreciate your time this morning and the opportunity to share a few words, and look forward to hearing what everybody else has to say and to answering any questions down the road.
Thibaut, thank you. I had a number of years when I was an administrator in a hospital overseeing environmental services, and the lessons learned there in terms of infection control and the awareness and what to look for and how to take care of things, as you've shared, the hospitals are ideal experts in this area. And I think the opportunity for the businesses in Kissimmee and in the Chamber of Commerce will be to learn from what the hospitals can share. Can you one more time give us that web address for the website reference resource?
Yep, certainly. The web address is orlandohealth.com/businessready, and the email address is businessready@orlandohealth.com.
Thank you very much. Our next speaker will be Davide Carbone, President and CEO of Osceola Regional Medical Center. HCA also has Poinciana Hospital, and also David's responsible for Hunters Creek ER, the Millennial ER, and the graduate medical education in collaboration with the UCF College of Medicine. He spent 25 years as a hospital CEO. Before coming to Osceola, he was the CEO of St. Mary's Medical Center in West Palm Beach, Aventura Hospital and Medical Center in South Florida. He also led strategic planning and operations for HCA, and David holds degrees from Duke University and Clark University. So look forward to learning what's going on at Osceola Regional and HCA.
Well, thanks, Ken. I'll try not to be too repetitive of what we've heard from the other two CEOs, because the funny thing is, even though we're all in different systems, we seem to come up with very similar solutions to challenges like COVID-19. Whether it be screening visitors coming into the building, screening your own employees and physicians, handling how you're going to do elective procedures during the COVID crisis and afterwards. It's remarkable to me that it just shows you that the industry crosses all the boundaries of ownership to come up with some other solutions that are data-based and meet the needs of the community. To that end, it did come upon us pretty quickly, and we were not ready for it as an industry, and each hospital had a learning curve. Early on at Osceola, we put together a committee of physicians. I called it the Corona Physicians Advisory Panel, CPAP for short. That's kind of an inside joke in healthcare. But then we changed the name later to the Crisis Care Committee. And it started off with just a handful of doctors, maybe 3, 4, or 5, led by 2 infectious disease specialists. But it quickly grew to 15, covering almost every area of the hospital and the specialties we serve. And they really were committed. We were meeting initially 3 times a week and twice a week, and now we're just meeting once a week. In addition to the meetings we had as operators of the hospital and the administrative team, we were meeting daily, sometimes twice a day, sometimes all day throughout the crisis, just to get ready, because so many things were changing so rapidly in the healthcare system. And, it was all to protect our patients and be available for the community. I think every hospital did a great job under stressful circumstances. And, we learned a lot from the experience. We were blessed by having plenty of PPE, the personal protective equipment that was in short supply in some areas of the country. We had testing that I think could have done better. And that is, again, to the industry as well as our hospital. Initially, we were having test results come back in 1 to 2 days through the county health department and the CDC. And then as the volume of testing grew and they couldn't handle it, we switched to commercial labs. And some of those labs were taking 5, 6, 7 days. We secured a direct contract with a lab and with our own internal lab called IRL. And between the 2 of them, we've now reduced that to an average of 1.2 day turnaround time. So it leads to quicker decision-making on the part of the physicians, whether a patient needs to be put in what we call a PUI status, that's a person under investigation status, or whether while we wait the test result, or whether they are COVID positive. Just some stats from Osceola. So far, as of yesterday, we tested 531 patients that have come to the facility, and 426 of those patients were negative. And now what about the positives? Many of those positives didn't even need a hospitalization. Many returned home to be isolated in their home and to work through the course of the disease. Some had very few symptoms. Other people were hit very hard, and many of them ended up in our ICU on ventilators. We had plenty of ventilators, and in fact, we had so many we were actually loaning some of our ventilators out locally to some of our sister facilities. And then HCA has joined a coalition of hospitals across the nation that were lending ventilators across the country to New York and other places that had a shortage of ventilators. We were, again, very fortunate through the government action, through social distancing and isolation on the part of the public, that we have not been hit with the tidal wave that was predicted in our community, especially Central Florida, but throughout the state, other than the 3 counties in South Florida. And even compared to other parts of the country, they're not that bad. So the resources were plentiful. We put in place many of the same things you've heard from the other 2 hospitals in terms of screening and visitor policies. And that was a big change for us. We had very open visitor policies, trying to make sure, family members can be with their loved ones when they're hospitalized. And now it's completely shut down until this week. We started opening up, just like the other hospitals, doing elective surgery, allowing 1 visitor per patient. Screening those patients and the visitors, making sure they're wearing masks, making sure they sanitize their hands when they come in, taking their temperatures. We're actually a pilot site for a thermal imaging study or process of taking temperatures. It's a little quicker than the individual handheld thermometer, which is working out well in our facility, and we may keep it in place and spread it to other HCA facilities. Working with the other HCA facilities in Central Florida, again, we did many of the same things, but working again across the industry. Early on, Sheila, myself, Brent reached out to each other and kind of stayed in communication, mostly through text. And it was, just beneficial to know what each other was doing. Later on, Thibaut joined at least a direct dialogue with me, and we were sharing information that you wouldn't think competitive facilities would share. But again, it was for the greater good of the community. So, as we start to reopen, we start looking at how do we get the confidence of the community. One thing we did here, because of our crisis care committee and the involvement of our physicians, we were early on with trying to find out the latest treatments for COVID, and we became a what's called a convalescent plasma therapy research site. And so we've been able to place patients in our facility on the plasma therapy, and those are usually patients that are in acute condition, hopefully not yet on a ventilator, but looking towards getting on a ventilator. Once you get on a ventilator, it does become more difficult to manage. But several of these patients have had that convalescent blood plasma therapy. And just a word to the public, if you have been COVID positive and you are now a survivor and doing well, and it's been 14 days or more, please call your local blood bank, which here is One Blood, and donate a pint of blood so that it can be used in the plasma therapy that is offered at many hospitals such as ours. Those units go to patients in need, and one donation of blood can save up to 3 lives. So please stay in contact with the One Blood people, and please donate, or have your friends that you know were positive to donate. That could save many other lives in the future. In addition, we're joining other research sites and activities such as remdesivir, which is the newest drug that they're saying may have good luck in treating these patients. And we're waiting for our allotment of that to start next week. So again, we're taking caution in the hospital to make sure it's safe. Hospitals have always been a safe place, but as the other said, we've just re-enhanced and emphasized hand washing and sanitation of surfaces. And it's developed a new culture, not only in the hospital, but in the community. I think people are very appreciative of the efforts we all take.
Well, David, thank you. There were a few things that you said I wanted to just reiterate. The first one is the sharing that took place between the hospitals. And I think, again, that's a good model for the business community as well. If there are questions or there are ways to work together, that would be a wonderful thing to do moving forward. The second is the involvement of the physicians. And certainly that's been a huge component in any hospital is working with the medical staff through something like this as well. And then the third was your mention of donation of blood. And while I happen to have had an occasion to give blood, I haven't had COVID-19, but I gave blood back at the early stages of this. And there is a need for blood overall as well for those individuals, even who may not have the antibodies. But and the nice part is I can share with you that the One Blood location at John Young and Sand Lake has done an excellent job separating chairs and so forth. So very, very mindful of risk conditions at this time. So thank you for sharing those items. And I want to circle back on the physician piece a little bit later when we get a chance to ask some questions as well. Thank you. Our last, by no means least this morning, panelist, member is Brent Burish, who's CEO of St. Cloud Regional Medical Center and also the affiliated physician practices of St. Cloud Medical Group. During his 6 years here, the hospital's improved safety metrics, patient satisfaction, it's renovated patient rooms, expanded the ER, and has a whole new main entrance. There are new physician offices also in Kissimmee and St. Cloud. And Brent has been a community leader, developing strong relationships with Osceola County and serving on a number of local boards. So with that, Brent, let's hear what's going on at St. Cloud.
Absolutely. Good morning, Ken, and thank you to the Greater Osceola Kissimmee Chamber of Commerce for hosting this event. And I'll echo a lot of what my colleagues said, but I think it's important to hear the repetition to help emphasize the safety of hospitals. Safety for us is the first word of our mission statement. It's first in our vision. It's first in our values. Our mission very directly is to provide safe, compassionate, accessible healthcare to St. Cloud and surrounding communities. That existed before COVID-19, but was certainly enhanced during the COVID-19 pandemic and state of emergency that we're still under, which technically we're about 2 months into. So predicting the future can be hard, but like my colleagues, we are now offering elective surgery, and we think we can do so in a safe manner. For us, some of the things you heard today, such as screening everybody with hands-free temperature checks when they come in, including team members, physicians, as well as any patients or visitors as part of our protocols. One thing unique in our facility, you heard Ken mention, we expanded the emergency department here about 1.5 years ago at St. Cloud Regional Medical Center. We actually have created a separate COVID ER. So now when patients come up to our facility, we've rearranged our front drive. We do a quick screening in a car setting with either paramedics or emergency department nurses. And then if somebody is screened as a potential risk for COVID, they're redirected to a separate ER on the north end of our facility. It is a physical ER structure staffed with ER nurses and ER providers. And if not, then they enter the main entrance of the hospital. So one added element of safety for us is physical separation from entrance for patients who are at risk or potentially positive for COVID-19 versus those who are not, who may be coming in for outpatient testing or surgery. It's something we've had in place for nearly a month now that has been very successful. It allows us to separate staffing predominantly during those areas, So we're not sharing staff back and forth from team members who may be caring for COVID positive patients and team members who may not be caring for COVID positive patients that shift, that day, or even that week. So it's a physical barrier in addition to the items such as social distancing, putting the markers down on our floors to make sure we have separation of 6 feet, even in our cafeteria space, if not included the main entrance, any waiting areas, moving seats, separating distancing, putting in glass barriers, things that we've done throughout our facility and adjusted to. I do want to go back. I believe Sheila mentioned in hers that today formally starts National Nurses Week. And I want to say thank you to all the nurses, not just here, but everywhere. It was earlier reported in 2020 that nursing was the most trusted occupation in the United States of America. And I'd say in light of COVID-19, it's the most selfless one as well. And seeing that here, and I know my colleagues would echo, seeing what they've done in being resilient, being on the front line every day, fearless in many occasions and providing care. If you all have the opportunity, please say thank you to a nurse, especially this week during National Nurses Week, for everything that they do. And on behalf of our hospital, we want to thank first responders, City of St. Cloud, spiritual care who have provided prayer services in and outside of our hospital, recordings for patients here, for events such as Easter, for those who may have wanted it. And then also the donations. We have had an overwhelming outpour of support from civic leaders, individuals, schools, businesses, others, coming through our facility to show their support for patients, for team members, for medical staff, and it has really meant the world. It's provided joy and relief from an onslaught of constant news about COVID-19. So for everyone that's been a part of that for our hospital and our medical group, I want to say thank you. One thing that we have added and continue to offer is telemedicine. So that includes the outpatient setting. St. Cloud Medical Group is 26 providers in primary care, cardiac, urology, general surgery, gastroenterology, ear, nose, and throat, and other fields. And all of them offer telemedicine right now, vascular surgery as well. Those are either 5 or 6 day per week appointments, depending on the specialty. And so if somebody has questions or concerns and may be concerned coming in, despite what you're hearing today of all the safety measures put in place, telehealth is available. In the hospital setting, we're even offering telehealth where it's appropriate. Every patient will be seen every day by a physician, but to allow that additional screening and level of safety to prevent any unnecessary exposure if needed. Like what you heard David say at Osceola, we do have a physician leadership panel that includes infectious disease, it includes pulmonary leadership, medical staff leadership in fields such as cardiology, orthopedic surgery, anesthesia, radiology, who have helped us make sure we have the right protocols in place, from proper PPE utilization, that's personal protective equipment, from proper hand washing, from proper distancing and isolation and restrictions of visitation in some cases, but making sure it's all meant and designed for safety. We have set up so that every shift change, at least twice a day, we offer family members to have a telehealth consult with their loved one in the room, and also for the attending doctor 7 days a week to have somebody around with them so that while they're in the room, we can offer that for family members the patients agree as well. So you can have a direct engagement if you're not allowed or unable to visit with the doctor who's caring for your loved one. It's another way we're able to use technology to add touch points back to what used to be given for granted, that you could be involved and sit at the bedside and be involved in care. And obviously we all want to get back to that, but as long as we can do so in a safe setting. Safety guidelines certainly include following CDC guidelines and working closely with Department of Health. I do believe that Osceola County Department of Health has been on the forefront, from offering drive-through screenings over a month ago to some of the other items that they've done. It also includes testing. St. Cloud Regional Medical Center has on-site testing. It takes about an hour for any emergency case for COVID-19. We do have collaborations, including that with Orlando Health, if needed to test further. But being able to have those resources makes a huge difference. We have tested hundreds and hundreds and hundreds and hundreds of patients at this facility, and we'll continue to do so as we progress going forward with this state of emergency. Similarly to our colleagues, we are requiring COVID-19 tests for anybody undergoing elective surgery or elective procedures, such as cardiac procedures. That is one further element to make sure that those patients stay safe prior to their procedure, that they know their diagnosis, and that any patient who may follow them stays safe. And it is something that we're able to do on site here in collaboration with our partners we're honored and thrilled to be able to offer that. And it is a quick adjustment. You know, as David alluded to, one thing that I think has been successful in Osceola County is the collaboration between health systems, all of us, whether it's AdventHealth, HCA, Orlando Health, St. Cloud Regional Medical Center, as part of CHS, being able to have those collaborations. Maybe even learned that some of the CEOs have presented use emojis on text change, which I never would have thought before. But you learn a lot about what's the best practice, what's a safe practice, and then tailor it to what's right for each individual facility and community. You know, with that and with honoring and following CDC guidance, Department of Health resources, utilizing technology appropriate, whether it's medical technology, whether it's telehealth or IT technology or more, I think we're able to keep safety, but also still engage families and patients in a meaningful way so that they don't have to delay care and feel comfortable and confident in receiving care when they need it. Ken, I'll turn it back over to you and we can move on to any questions.
Very good, Brent. Thank you. You know, you bring up an interesting point. In the 20 years that I spent working in hospitals, it was not difficult to find the hospital. You just followed the blue H. But in recent years, that blue H has blossomed for every one of our hospitals all over Osceola County and all over metropolitan Orlando. And by that, I mean the expansion of affiliated physician practices. And now, of course, we also have the virtual that a number of you on the panel this morning have mentioned, the idea of the virtual practices, the telehealth as well. Do you believe, and this is a question for all the panel, do you believe we're going to see a major change in the way healthcare is delivered in the future as we look at this idea of not only expanded physician practice locations, but also the idea of being able to reach care from home using telehealth?
So Ken, I can start in that I don't think telehealth is going away. When we started this process, we had one of our provider groups on telehealth offering telehealth appointments, and now it's every provider in every specialty. It's nearly half of the appointments right now that we're providing. We had over 2,000 appointments in the last 5 weeks on telehealth already, and we expect that to continue. So I don't think telehealth is going to go away any point soon, especially the longer that this state of emergency lasts and the more people get used to telehealth. It certainly has applications. It may not exist in the current function as things progress, but I do think telehealth is going to be here for the long haul, yes.
How about our other panelists? If Christina, if you can open it up and to anyone who'd like to comment on that as well, in terms of what does the future look like in primary care outside of the hospitals, but at the same time affiliated with the health systems?
Yeah, I'd just like to comment, you know, the telehealth is not only here to stay, but it will grow and we'll find new ways of using it. And we're all using it to some degree. And this technology has been there for a while. I'll get on my little political horse here and just say that the government and many private insurers had chosen not to reimburse for telehealth for the last several years. And it took a crisis, the COVID crisis, to get Medicare to open up the doors to telehealth and to reimburse providers who are using telehealth. So inadvertently, I guess it took a crisis to free up the technology that's been in place. And now we can move forward as long as they continue allowing doctors to bill for providing telehealth services.
Yeah, I think adding to that, if I may, and I agree with both Brent and David. We've leveraged telehealth across all specialties. It's been particularly helpful and adopted in primary care arena and the cardiac arena. And I think whatever fear we may have had around it's less personal, you know, you can't provide you know, appropriate care that way. I think we've been able to dispel that. Many of our physicians have really embraced it. I think they're finding that they're able to be more efficient and in some cases actually spend more time with their patients because there's less, you know, navigating from one room to another or one site to another. I think it's promoting teamwork between in the physician practices between the staff in the office, the nurse and the physician. I share with you that within my family, my wife needed to use you know, telehealth for a primary care visit. And really as a consumer, I think she found to be extremely user friendly. She got to speak to her own physician, and probably most importantly, she was able to have her visit in you know, in a 15-minute time frame and didn't have to take the time to drive to the office and whatnot. So I think how it ends up looking in the future, I think it's hard to tell. I do think that in the very near term, we'll continue to see a heavy reliance on it. And I expect that as time goes on, we'll have to find what that balance is between the virtual environment and the physical environment. But I definitely think it's here to stay.
I would agree with all of my colleagues. I have nothing different to share. One thing I wanted to say is that in our physicians lounge, one day I found two of our physicians discussing telehealth, and they were competing against one another as to how more efficient they were. And the other one started asking and sharing, well, how is it that you accomplish this? Because they find that it's just going to be here to stay. And it's just something that happens during a crisis. We become more innovative.
We had a health summit, the Community Vision Health Leadership Council last year, and the geography of Osceola County was actually one of the things that we talked about, and how difficult it can be in many areas of the county, going east and west because of traffic conditions in the northern end of the county, or certainly the vast space. And the only place I can think of in Florida where you can go 55 miles between two interchanges on the turnpike with nothing in between. So geography was an important piece, and the summit basically said we have to find ways to deliver care electronically and mobile care. And so certainly, I think this is probably advancing that based on what you've shared. I also wanted to share with you that it happened at Osceola Regional a number of probably 7 years ago, was the advent of the Southeast Telehealth Resource Group demonstration of what it looks like to use telehealth. We projected on the wall of the classroom, and the gentleman in Georgia showed where he had shaved that morning, and you've never seen anything like a whisker magnified 400 times so you can see whether it's shaved across or at an angle. So it was an incredible thing, and the telehealth really does offer a great deal of opportunity. One of the reasons I brought up physician practices is because as we open this up for questions and so forth from the business community, again, many of them may not have need or reason to come to the hospital, but are looking at what can they do in their businesses and again, accessing primary care and so forth, as we've talked about. So what are some of the safety measures? You've outstanding job this morning outlining what your hospitals have been doing and all of the different pieces. We know about hand washing and sanitizing for both the employees of a business and also the customers. We know about physical spacing. We know about hands. I was on a cancer conference call recently, and the physicians shared, just know what you're doing with your hands at all times when you're out in a business or somewhere out in the community. Any other ideas and thoughts in terms of things you'd like to see that might help the employers that are tuned in this morning?
I can go ahead and begin. And Ken, it's important because I have been sharing around our facilities too that our hands, even though they're attached to us, right now they could very well be our enemy. Because if we're going to catch COVID or anybody is going to get COVID, it's because of our hands and what we do with them. So proper hand washing is extremely important. But one thing I wanted to share is that for all of our medical groups and our central care locations, as well as all of our outpatient offices, for our patients and people, instead of waiting in crowded offices, we are using a virtual check-in, and people can even wait in their vehicles outside of the practice until a room is ready. I think that's something that now, using technology, it makes it very easy to text people when the room is ready or when the physician is ready for you. So we are actually utilizing that technology, and also checkout procedures may occur completely from the patient's mobile device as well. So that's something that you're going to be seeing in our clinics and our outpatient facilities.
Sheila, I just wanted to mention earlier, we did a dry run yesterday, and you were masked at the time. I saw Brent in a mask earlier today before we got on the live broadcast. And of course, you're in rooms by yourself, so it's okay now. But that brought up an interesting point. Study recently showed that most of us touch our face 50 times a day. Mm-hmm. So if you consider that, the mask not only helps us to protect ourselves from someone else, it also protects us from passing something to someone else. And at the same time, it tends to get in the way of touching our face, which is a good thing. So again, wearing the mask is so important.
Ken, if I could weigh in just real quick on some of the best practices, and I certainly want to hear from the CEOs who haven't spoke on this topic, but I've been attending a lot of webinars from the U.S. Chamber. I'm on the return to workforce for both Osceola and Orange County's regional workforce. So this is a heavy focus of what's the best information as businesses prepare to open. And so we've got all this on our COVID-19 resource page at KissimmeeChamber.com. But I think the key things to recognize from a consumer standpoint, someone visiting your store, is to have hand sanitizer right at the entrance so they can quickly wash their hands as they enter the store. One suggestion from a national pollster or consumer researcher was to have an employee physically cleaning some aspect of the store. That creates such a strong visual for the visitor to see. And another one was to have your protocols posted. So that's something the workforces are trying to establish is protocols that every business can follow. I'm sure you hear this over and over again. The hospitals certainly are practicing this. But if you were to even take those and rebrand them your own, or at least post those prominently so the visitor can say they've thought about this, ideally they're following this, is another key consideration. And the last thing for consideration was a health certificate to be posted in the business. So the health department had maybe said, yes, this company is following proper protocols. And you see this in other states, certainly in restaurants and things. So we aren't there yet. I know there's discussions locally, at least in Osceola, about getting there, maybe establishing that health certificate. But those are a few things to consider as practical solutions as you open up your business in each of these upcoming phases. And the one thing we want to guard against as business owners, and hospitals are very keen on this, is liability. And so what you don't want is to not practice these protocols and expose yourselves to liabilities, because until this is solved at the state and federal level, which we expect it to be eventually, there are some folks who might prey. And so you want to do the right thing. Obviously, we don't want to backtrack to increase the COVID-19 situation we've just experienced. But at the same time, you want to protect all that you've put on the line in operating your business. And so we're going to talk more about that liability issue on Friday in a webinar. But I did want to put that on the table, and I'll turn it back to the CEOs. But so I won't intervene again, except to close it out. I do want to say, hearing the discussion from the CEOs about the collaboration amongst each other, it really warms my heart. But that doesn't mean I need my heart checked out. It's tremendous. Y'all are working together for the betterment of the community. So thank you.
John, if you need your heart check, we're open for you too.
I knew, Sheila. I knew.
Just one thing on the sanitation that everybody's going through right now in terms of their facilities, not only at hospitals but businesses. We've gone to such an extreme. One of our doctors who had been traveling at the start of the COVID virus epidemic or crisis came back, and he's on the high side of his age, I'll say, and he said he was fearful to come into the hospital. But when he did, he saw what we were doing, and he had to pass through the screening process, and he saw how we were controlling visitors, and he saw how we were cleaning the facility. He said he went back to his wife and said, I'm safer in the hospital than I am at home. So, every business needs to strive to getting to that point where people feel so comfortable that they are bragging that it's safer to be someplace they thought wasn't safe, and turns out it's very safe.
Go ahead, Brent.
I was going to say, for the business community, our hospitals work with downtown Main Street. CDC has some very successful and I think easily accessible links with best practices. As you heard each hospital say, I believe, we all test all of our employees before they're allowed into the facility each day. Each business has to decide if that's right for them. But in terms of what screening questions to have, how to take temperature checks, whether that's appropriate for your business or not, CDC actually does have a ready for work guide. Fairly easy to Google and search. Again, we assisted as our hospital, some local businesses in downtown Main Street. We're happy to provide that service. I'm guessing most of my colleagues here would be as well. But I think that's a great place to start for some evidence-based practices as businesses look to reopen.
Yeah.
One thing I would say, and I think what we're all trying to accomplish here, whether it's trying to get our community to feel like it's safe to come back to the hospitals, or frankly, like it's safe to come back to a restaurant or, the local shops. What we're trying to do is build our community and consumers' confidence that it's safe to do so. And I think to David's point, I think we all experienced similar things where we took measures at our hospitals to provide that confidence level, first to our employees and our physicians, and then to our patients. the most important thing and maybe the biggest takeaway I would send to our business community is thrive for consistency. And I think that John talked about making sure there's an outward appearance, that there are things that are different that are occurring in all of our businesses. And so we know that there are three key things that are really, really critical, right? Hand washing, cleaning, appropriate cleaning and sanitation, particularly of those high touch areas, those areas like doorknobs and light switches that are frequently touched, and social distancing. So keeping 6 feet apart. And then when social distancing is not possible, it's wearing a mask. I think this is where it's really important for each business to decide, what am I going to implement and how do I effectively teach my team members, my employees, to do it on a consistent basis. I think that when consumers walk into our restaurants, our shops, and our hospitals, they see that there are ample hand washing stations, and they actually physically see people cleaning surfaces, and they see that masks are being used appropriately, and that somebody's engaging them and maybe encouraging them to do the same, that will build consumer confidence. One practice that I might recommend as something to consider, and may or may not work for every business. One of the things that we did, and I think you heard, I think it was Brent talking about a separate physical area at St. Cloud Regional where they housed their COVID patients. I'm pretty certain that all of our facilities have done the same. One of the roles that we really created in this area was the role of a safety officer and the role of a high touch cleaner. And the sole purpose of the high touch cleaner was to every 15 minutes clean areas that were high touch areas. And the role of the safety officer was to make sure people were properly wearing their masks and taking on their PPEs. I believe that a similar role could be added, and not as a new role, but maybe it's you add that as a responsibility to somebody who is looking at and making sure that those things are happening. And I think just something to consider, that even a small business can identify one employee who has the ability to keep an eye on the overall facility, who can ensure that those things are occurring. But I think those steps are all things to consider. And I don't think it has to be a laundry list of 150 items. I think those 3 or 4 items and that are done consistently will do a lot to gain public confidence.
Just in the thank you, and I think those are all excellent ideas to look at. We've been talking to the business community, and yet at the same time, we should be looking in a mirror, because some of the biggest businesses in any community are the hospitals, and we know, or those of us at least in the business, that the elimination of elective surgeries, the Healthcare Advisory Board says that's a possibility of a 51% reduction in revenue nationwide in hospitals. The business communities in Osceola County rely on the hospitals as significant drivers of the economy, both in your payrolls and in your purchasing and others. So as we kind of wrap up, some thoughts or ideas on how your organizations have been impacted by this, and what are your thoughts going forward in terms of how to come back from this COVID-19?
Well, I'll start just by saying, yeah, it is an impact. We're a 400-bed hospital. This time of year, we'd be running a census of 400. We're now in the upper 200s to low 300s on a great day. And the ER is probably less than half the volume that it has been. And again, we just want to emphasize, and I'm sure all the hospitals do, again, we have isolated COVID patients. We have separate areas both within the ER, a separate COVID unit, we're calling it, and up on the floors. So we have a separate ICU and a separate general unit for these patients. The staffs are dedicated to those areas. The doctors are dedicated to those areas. So we are doing a lot to, again, soften the image that if you go into a hospital, it's dangerous. And as that one physician who visited after traveling, he was so impressed with what we do. So I think all the hospitals are in that boat. We're also in the boat of, we've lost a lot of volume. People were told not to go to hospitals. And how do we regain their confidence? Over time, if you're having a need for surgery or a need for some kind of procedure, you're going to end up coming to a healthcare facility, whether it be a hospital or a surgery center. And so, we're looking forward to the day when things get back to normal. I'm very much looking forward to the day where we don't have to wear a mask anymore, and that may be a while until we get our hands on this virus and can have a vaccine. But that's a horrible new norm if we have to wear masks every time we want to engage in personal interaction. And part of the art of healthcare is the touch and the feelings you extend to the compassionate feelings you extend to the patient. It's hard to do that through a mask. It's hard to do it when you can't touch a patient without gloves on. So we hope to get back to normal as soon as possible. We'll follow the lead of where the community is going and where the industry is going. But yeah, we have been impacted, and we have taken care of our employees during this crisis, but we want to get them back fully employed and back to normal.
Yeah, Ken, similar impact, I think, across our facilities. And I think, David and I have spoken, offline, and I think our the volume impact has really been pretty comparable. We've probably seen the greatest impact in the emergency room, which is understandable. At the same time, kind of repeating something I said earlier, it is somewhat concerning because the reality is the reasons for people going to an emergency room haven't disappeared. It just means that their concerns of going to a hospital have outweighed their concerns over whatever symptoms they were having. And so I think, if there's one takeaway message from today from, all of our facilities, I think is that, our hospitals are safe places to go to and please seek care. With all that said, I think, a lot of what we've been talking about today, I think is some of the work that we're all doing to get our hospitals back. It's taking an active role in educating the community. We're working with our physicians as well to give them confidence, but to help them give their patients confidence that it's safe to come back to the hospital. And David just talked about a new normal. I think we're all trying to project and anticipate what that new normal is going to be, so that we can be proactive and redesign our business model, as needed to be able to do that. And so, the reality is, while the hospital industry has been affected, the entire economy has been affected. And I think it's incumbent on all of us to figure this out together. I think it's great that, we can sit as, 4 leaders and 4 competitors, but essentially 4 colleagues, and collaborate on an initiative like this and this type of communication. And I think what you'll see from all of us is the continued desire to be part of our business community and to do our collective parts to help Central Florida, Osceola County, come back to great prosperity and the great path that we were on just a few short months ago.
Thank you. I know, John, watching the time, we're coming up close. Do we have time for Sheila or Brent to add anything?
Please. Absolutely. Sheila, Brent,
okay, I'll keep it short.
Go ahead.
I would say ultimately we are here to serve the community. Obviously, all the hospitals and all the economies have been impacted, as our colleagues have mentioned. Just know that we will do whatever it takes to be able to be here in order to serve you. So whether it's reducing discretionary spending, anything like that, whenever something happens in an economy, everybody needs to adjust. So just understand that we're adjusting our pockets as well. But we will be here to serve the community. I know we don't have a lot of time, so in my closing, I just wanted to tell the community 2 things. Wear a mask, know how to wear the mask, don't touch it, and wash your hands.
Thank you. Brent, any last-minute thoughts here?
No, I think it's well said. I'll simply add that I'm amazed by the dedication, resolve, and adaptability of our team. You asked what the impact is. Many of them have taken on new roles for us.
Mm-hmm.
Highlighted a couple of his facilities. We've certainly done the same here, and I'm sure other businesses as well. And I continue to be amazed by how quickly adaptable, but in a very professional and trained manner, the team here has been. And some of that will become permanent business models for us. And I'm sure this will stretch to other industries as well. Otherwise, I think the colleagues here summed it up very well. There is an emphasis on safety. I believe that we all have relatively similar processes, but successfully implemented plans to make sure the community stays safe in and out of the walls of our hospital.
Well, I want to thank you all today. As a former broadcaster, I'm very pleased that we now have 45 seconds left for you, John, to finish out, and we'll hit that 1 hour mark.
Ken, you did great. I can't thank you enough for moderating this and especially working with Community Vision's Health Leadership Council and all the work that you do for the community. Thank you, Ken. Brent, David, Sheila, Thibaut, thank you for your leadership and for your cooperation again in the community. It makes a difference, and it's also what makes Osceola County a great place to work, play, and live. And with that, we're going to hit here at the last 18 seconds with just thanking all of our audience for watching and encourage y'all to have confidence in your healthcare providers. And if you're sick or if you're curious about any ailment you may have, to go get care. Thank you so much, everyone, and we'll see you next week.
Thank you.
Bye, everyone.
Bye-bye.